So it's week 2 already, and it's going to go by quick. Next week is the reviews for the exam, and I'll be posting those times right after class when I post your recording and all of that. I post it with a study guide, a handout worksheet that I already sent you. I sent that on week 1 already. I'm going to send you a PowerPoint that goes with it. I'm upgrading it because all the exams are new. They're all different questions in there, and all of us choose our own questions. So that's something new that we're trying to, of course, again, keep exam integrity. Um, so I will be posting that right after class, and you will have it all in one place. The study guide, the Kahoots, and you will have the review times. There are 3 professors, so there's 3 different dates. Another thing I'm going to be doing next Wednesday at 6 p.m. is I'm going to do a dosage calculation review. I've had a couple students here and there ask for it. So I've just decided Wednesday, 6 p.m. covers day, night people. Hopefully, if you can't come, I, of course, will record it, but it's always better if you come. Yes, Tamara.
Will that include the pediatric dosing?
Yeah, that's what I'm doing.
Okay.
Yes,
Okay.
absolutely. What I do is find out the types of questions you get and try to review them and show you how to pull them out. I also even have some community questions, which are slightly different that I'm also going to go over. So it's going to be a good thing for you as review. Those are good at math because there's some different ways and different types of questions. But I think the one thing I do is show you how to choose the numbers you need to work with. Okay? I make it logical and I only use 3 formulas. I don't have a bunch of formulas. I don't use ratio proportion. I don't add cross out. That's just for me, it's just too much chance for error. So I just show you how to pull it, all right? And make it
Professor,
easy.
it's
Yes.
it's because of you I learned pharmacology and math in general. So thank you. I got a 92% on my HESI and MedSearch 1. So
Look at
it was
that.
because of you. So thank you.
Good job. Proud of you. And Yvette did not, oh my God, she was horrible. Sorry to say this. She was horrible. She really had no clue about math. And we spent a couple times together and slowly we picked it up. And
Absolutely.
it's me doing those recordings, making these worksheets, looking at your other exams, trying to give you those types. And then you have to figure out what your formula, what you're going to use, et cetera, et cetera. So that'll be next Wednesday. So a lot of stuff. Thursday is, I believe, your review at 5 o'clock. So I'm trying to be cognizant of day, night people, put it somewhere in the middle for you. Again, I always will send out reviews. The one thing with reviews I do also, I will put one announcement and I'll keep editing it and putting all the reviews in one place. You have 3 professors, you're not going to have 3 announcements. It'll be one and I'll keep renewing it, okay? So that you don't have to look all over. You with 3 courses will appreciate that. Help keep you organized as much as I can. So, this week you just have the discussion question due. Um, when we talked last week, it was, your Piagets, and this week I have not done those discussion questions yet. Sorry, I haven't been feeling that great, but I will be doing them this weekend because I actually work 7 days a week, here or there, and get it done to let you know what's happening with them. The theorists are probably one of the hardest. I want you to know that you're going to see at least 6 questions on theorists on your first exam. So be prepared. They're not hard questions, but you have to know what is, autonomy versus shame and doubt, like what was on the quiz. Okay, those types of things you'll need to know. So let's go ahead.
There we go.
Oh, totally appreciate that. I've gone on and started lecturing and didn't record. So I appreciate you telling me. Thank you. Okay, here we go. We're going to go preschool, school age, adolescent. I mean, we've done 3 groups the first week, 3 groups the second week. A lot of information. How do you keep it all apart, right? What's what and what's important? So, when we talk about your children, preschooler, this is a great age. Christian just graduated from this until he just turned 7. But all of these things, you can see a child at 3, which is the beginning of it. They're still children, still baby-like, and then they get to be 6 and they're grown up and they start with questions and you're like, how do they know this stuff, right? Now, again, everything's slow. Growth is slow. And we know that by 1 year old, their 1 year old weight will double. So it's like 6 times the amount will be by age 5. Now, you're going to have all different variations of it. You've got children like little tiny Christian, he still weighs 49 pounds, born at 7 pounds. So he's not where he should be yet. He's still tiny, but he does all the things. Cognitively, he's aware, gross fine motors, he's all advanced. So that's what we look at. We know that at age 3, they're still clumsy, walking, running, falling. And by 6, they're getting more and more and more agile, athletic, and, they become sticks. They start growing up and they're not as pudgy. All that baby fat is starting to slowly go away. We know in preschoolers, all of their teeth are in there. They're baby teeth, right? And now we know, are they right-handed or left-handed? Now, for years, we're like, what is Christian? He'd use both hands. He'll throw with his right hand, he would do things with his left hand, and he is an absolute lefty. So he's the only one in our family who's with his left hand. And he has issues with writing, et cetera, et cetera. That's his one really weak thing with him. Now, Piaget, now remember, Piaget talks about thinking, understanding, understanding how and why things do what it does. It's also thinking like that, it's called animism. It's like making things alive. Sometimes it is the toilet going down. They think it's a monster with its mouth opening, swallowing their, urine or their stool. I mean, they'll take brooms and they'll ride around like, horses. And then we're going to have inanimate objects are going to be real, like a tree is a real, and we'll be talking to teddy bears and cars. And, that's their magical, right? Magical thinking. They're really understanding a lot more. I mean, this artificialism, look at this. It's about the clouds up there. It says those clouds are up there and there is none because somebody's blowing and they all went away. Or sometimes they're different colors, like at night, right? Sunset. Somebody painted that sunset. These are real things. They're starting to think differently, but they're thinking. Remember, cognitive, Piaget is about the brain thinking. They also understand about now. They don't really understand later on, okay? They're starting to use things, like I said, like put their arms out and be an airplane, and they're using what they have in their environment to have fun with, all right? Um, Let me see, what else we got? Another thing we talk about is culture. Now, culture is whatever the family is at this age, whether it's religion, whether it's, the way you act and behave. It's those manners, if that is part of the manners. So it really influences the family, all their culture, how they speak, how they behave, and that sense of initiative. If they're going and picking up their clothes and putting it in the dirty laundry or hanging their towel after their bath, all of those sort of things, okay? And that's just part of the family, right? Mommy, daddy, or nana, showing them, do this, do that, you didn't do this. Did you say please? Did you say thank you? All of those things. Now, At preschooler, these kids should be putting together sentences. They should be able to express themselves. Sometimes, of course, 3-year-olds have more difficulty than 6-year-olds, but they should be able to express themselves. Now, if not, it needs to be investigated. It's one of those growth and development things that they're not doing what they should do. We need to investigate why. Is it because they have other kids who speak for them at home, so they don't need to talk? That could be it. Or is it something brain damage, genetic? Hearing loss is huge. When you talk language, think about the first thing we're going to test is hearing. Can they hear? So they can't hear, they don't know how to say it, right? So first of all, we'll do a hearing test, and then we'll be looking at all of the other stuff. Sometimes you will see it's psychological. They don't want to talk. Maybe they're stressed out or something. Maybe they've had an infection, or maybe their home environment isn't good. So, poverty, drugs, malnutrition. And these are realities. These do happen in real life, and they're not going to talk. They tend to be quiet and they internalize and they go into themselves. Now, putting a kid to bed can be a hard time. Sometimes mommy or daddy has to go in and lay down and fall asleep with them, right? And, it can be really difficult because parents still have a lot of stuff they need to get done, right? Parents always have stuff they got to get done. But what is said in the book is, first of all, right before bed, there should be quiet activities like reading a book. Whether it is not just reading a book, maybe it's watching a movie together. Not a crazy bang bang movie, but something nice and light, all right? So they're getting used to what signifies, okay, time to chill out, time to relax. I'm going to bed soon, right? Many kids will get into bed and they'll go, Mom, I have to go to bathroom. All right, go to bathroom. Mom, I need something to drink. You give them a glass of water. Mom, can I have another kiss? I mean, and it goes, Dad, I didn't get my kiss. Nana, could you give me a hug? And it goes on and on and on and on. Now, if we're always answering those calls, you are rewarding bad behavior, right? So if we don't do that, and we just do what we're supposed to. Quiet time, rituals, bedtime, getting to bed, they do a lot better with that. So when we talk about play, we know that play is all depending on ages. We know that toddlers are the parallel play people, as in two kids playing next to each other, not sharing a thing, right? Well, as we get into preschoolers are notorious associative players. They all play with their toys together, but there's no goal. They're just playing with the same stuff. They might be imitating each other, but there's nothing, organized about it at all. Now, cooperative play is at the end of preschool and into more school age, where there is a goal, whether it's sitting there playing checkers or playing sorry. I mean, Christian has a Paw Patrol sorry. You pop the button, and he knows that he needs to put all his things in home and then he'll win. And that's cooperative play. So playing together, two or more people, somebody wins. That is that. Children that are preschoolers now want to help. They want to help you put the stuff on the table. Remember, you're not going to give them knives and glassware. It's going to break. So you have to be really careful what you have them moving around, all right? Also, maybe it's, they had dinner and they dropped food on the floor and you want them to get the little broom and sweep it up. Well, they can learn how to do things like that, and it's really good for them. Maybe it's feeding the dog, getting a scoop of food, putting it out. These are things to be done, along with, of course, putting your shoes away, your clothes in the laundry, hanging your towel after the bath. All of those stuff give them a sense of accomplishment. That's the initiative. They like that, all right? Again, we know that They want to know about mom and dad and everything about and why they do stuff. So they're going to be asking questions now. They at this age are afraid of being hurt. They're afraid of getting a cut and blood. Oh my God, Christian. Oh, no, blood, blood, blood. Well, wipe it off with soap, put a band-aid on it, and it's cured, right? Because it holds the insides in. They also feel that if they're hurt, they're being punished because they did something bad. Maybe they hit their sister or they didn't listen to mommy or, whatever it didn't finish their dinner. And all very, very, very common. They're also, again, that younger, that 3-year-old, that younger of this preschooler. Again, they're closer to toddlers. And, toddlers are me, mine. It's hard to share. So they have to be taught that you do share. Everybody has time with a toy. You'll get it back when your time comes. Now, 4-year-olds, oh, they love to show off what they can do. Getting dressed, putting their clothes on, taking a bath, remembering to put their towel, clearing the table when they're done eating. Oh, they love it. And they're going to show it off. They're starting with scissors. And in preschool, they get scissors and they're going to be cutting stuff. Today we don't have to tie shoelaces. Today we have Velcro straps on everything, don't we? I remember as a kid sitting down and trying to figure out how to tie my shoes, bunny ears or whatever it was. But, the funny thing is, there's very rare a young kid that has a shoe that's with the laces. Their vocabulary is getting really big, 1,500 words. And now they're starting to want to make things. It's taking, for instance, popsicle sticks and maybe a cork from the wine bottle and putting them together, making a boat, throwing it in the water at a pool and watching it float. They love to do stuff like that. Getting a box and cutting it up and making it into a Halloween costume. Christian made a car when he was 4 years old, and we colored it and decorated it and cut holes in it, and he put it on his head and he went around house to house, and he was so happy. He didn't want a bought one. He wanted that car on his head, okay? Loves, 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 loves stories. Loves whether it's a movie, whether it's a book. He wants to figure it out. Why did that happen? Why didn't this happen? And part of learning is, parents being patient to answer all these questions. And they're really into death. They get this death on their mind, and everything is all about and the death, and they're gonna die. And you're like, where did this come from? Where, is kids at school saying this? I don't know. But they do have this, overwhelming talking about it. Yes, Joshua.
That's true because like I draw blood, right? And I also work with kids and they would be like, oh no, I'm gonna die when I'm drawing their blood. And like, it's like, no, relax.
They don't worry. I'm going to put a Band-Aid on it and it'll be all better. That's all you have to say. Show them the Band-Aid. I mean, I have Batman, SpongeBob, Pokemon,
True.
whatever Band-Aids in this house, hundreds at a time.
And it's funny.
It
And
works.
then they blame their parents. They be like, you want me to die? Why you want me to die? Or they go like that, like they say those stuff. It's
Yes,
funny.
they do. Absolutely. Thank you, Joshua. Amanda?
So my parents breed and sell horses, and they've been doing that since I was about 3. And it was around that age when my first horse died.
Oh,
And my
now
parents
you're into death.
they had to explain to me, but they were pretty good about it because the way that they explained it to me was exactly what happened. Look, the horse was really old. Sometimes when things get older, eventually it comes a time, and I was beside myself. I could not understand. I
Yep.
didn't
No,
get it.
absolutely. Absolutely. Christians, well, his father, my ex-husband, my daughter's father died about a year and a half ago. So he was what, 5-ish. And he was okay with it because we sat down with him and explained what happened. But every now and then there are questions.
Well,
And
yeah,
still,
there are questions because my biggest question was, but
where do they go?
where did it go? Is he coming back?
Right, right,
They
right.
had to get me another horse because,
You were lucky.
well, my parents have been breeding and selling horses my whole life.
That's
And I was
wonderful.
always competing since an early age, and I still compete.
Are you in Homestead?
No, I'm in horse country, right off
Oh, okay.
Turnpike.
Oh, okay, okay.
So it was one horse would die, and then there's like 20 more in a paddock. He'd pick one and be like, okay,
This
have fun.
one's yours.
And then if he would sell it, and then I'd be like, okay, now
Now
what?
what? Now what? Yep, 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 yep. So, I mean, you could see how children through these examples that they are, it's a little explanation, and sometimes it's an ongoing, and the consistency is what the children need, the same story. They don't need something else, that gives them the comfort. And I mean, death is a reality in life. It is. And getting hurt is. And making them understand that they're not going to bleed to death, and that, for instance, having an appendix at this young age, 3, 4, and 5, they think that they're sick and need to go to surgery, and now they're getting a hole put on them. It's like getting blood drawn. Like, that's rough. Well, think about having surgery. And I know I'd sit next to them and talk with them and tell them, listen, you didn't do anything wrong. There's just a little piece of something in your body. It doesn't want to be there anymore and it's broken. And if we don't get it out, it's going to make you sick. So they're just going to go in through your belly button. They'll get it out. You'll be asleep. And I'll tell them to put an extra tight stitch in there and a Band-Aid on it to make sure your insides don't come out. And you know, that kid goes to surgery a lot better because of that explanation. And not only in this area, in some of the younger school age kids too. So it is a big, big reality. Okay, 5-year-olds, they want to do more and more and more for themselves, and they should be encouraged. You know, setting them to do their bath and their showers. You don't need mom, dad, or whoever there to help. They have to learn. They need that responsibilities. Again, questions. Oh my God. Christian is just like his mother, and his mother was, I thought I was over all the questions every day. And to this day, it's 1,000 questions a day. She is, doing extremely well. She is in real estate, has her own group of people working for her. She's at some government planning meetings in Orlando. She calls mommy because she wants to know what a mammogram is and if it's going to hurt, and how is it going to be done. It's like questions, questions all the time, and they never, never, never stop. Children can ride a bike by 5 years old, and sometimes a bicycle, and some with training wheels, depending. There are some 3, 4-year-olds with a regular bike, again, but they'll be up pedaling something. This kid can play computer games and use my phone better than I can. And he tells me how to use it. And they love it. And it really helps them with the thinking. And a little bit is good, a lot is not good. So, I mean, Christian was in here trying to get my phone. Well, he used it this morning, and he's not going to use it till right before bedtime, where he'll calm down with it. They do need limits for the behavior. You do that again, you're going to get a punishment, right? It's like the timeouts, 1 minute per year of age. I mean, Christian's up to 7 minutes now, so he doesn't want to be put on timeout because he does feel it now. We know that these children have to learn how to control their outbursts. For instance, in school, they can't get upset, slam something, and expect the teacher not to get upset, right? Again, there are rewards for good behaviors. Again, don't bribe a kid. They do something good, they get a good thing. Don't say, if you do that. Now, that's a bribe. So they don't know the good and the bad. And always, of course, positive behavior. It's all about Kohlberg, right? Doing good or doing bad, and you'll get a consequence for each. At this time, these children want the praise. And again, always consistency. Consistent, consistent. Now, thumb sucking. There are some kids that'll thumb suck forever. My daughter was this finger like this. Left hand, pointer finger in the mouth, never a thumb. Now, it is okay. Remember, what do oral satisfaction do for the young children? As
Comfort,
long, yes, yes,
soothing.
it's self-soothing. They calm themselves. They're stressed. That's what they do. They sit there and they're thinking and they put themselves to sleep that way. Now, as long as their permanent teeth aren't in, it's okay. Once the permanent teeth come in, you can disfigure their teeth, right? So we tried to stop it, at that point. But remember that what that finger does for them, it does help them in those stressful times or when they're tired. Now, bedwetting can occur. It could be, kid always has be the bed, 8, 9 years old, or 6, 5, 6 years old. And they regularly are wetting the bed. And then there's some who have been dry potty trained forever and ever, and all of a sudden they start to urinate in the bed at night. Well, that's when you need to investigate. It's more common in boys than girls. But what could cause a kid to urinate at night when they've been potty trained forever? Well, look at the things and diagnoses that are here that cause you to have extra urine. Well, a urinary tract infection, you're going to have frequency and urge, right? So that can happen. Diabetes, whether it's mellitus or insipidus, both, one of the symptoms is urinating a lot. They could have a seizure in their sleep. And during the sleep with a seizure, they could urinate or any abnormalities in their urinary tract, and then any sort of sleep disorder. Kids can get sleep apnea. You get those kids with big tonsils, big adenoids, and they can. So, as a nurse, what are we going to teach our parents? And if the kid's old enough to understand, right? We want to know when they're urinating, how many times a week, and then we want to know during the day. Tell me how often you urinate. And tell me, was it small, medium, or large? And it was fast or just a slow dribble? Those are the type of stream, the voidings, et cetera, et cetera. If they're having some pain with urination, we know that needs to be investigated for sure. And they always say, don't give any fluid after dinner. After dinner, they shouldn't get any if they can't hold it because they will wet the bed. Now, there is incidents of family history. Like if mom or dad maybe urinated later on and wet the bed, maybe the kid will too. And always remember, stress affects kid every way. It could cause them to regress and to urinate in the bed at night and have enuresis, okay? We know medications, of course, and it's just part of kids that it can happen. So we always tell the kid, go pee before you go to bed, right? Go brush your teeth, wash your face, and go pee. All right, come to bed. And that should help, but not always. So what do we do? How do we do this and how do we change it? Well, number one, we got to figure out if there's something physiologic. Is it diabetes, whatever? Is it a urinary tract infection? Do a urinalysis. And after we checked all that and that's all okay, then maybe they need to talk to somebody. Maybe it is stress related. That behavior modification. There are medications today, but I think that's the last thing as a parent I would want to do to it. And then bladder training exercises, stretch and increase that bladder size. My daughter today, put her on a road trip with me every hour with nothing to drink. We have to stop and she has to go to the bathroom. Today, she's 38 years old. I've gone on multiple trips with her, and I'm like, don't you drink anything. Every hour, you have to stop because, and we've had it investigated, she just has a small bladder and it has never changed. Now, preschool is a great thing. Kids start learning how to be with other kids. their structure, right? They have to cooperate with other kids, and you got to deal with every other kid's attitudes and behaviors, right? And if they're doing good and the teachers tell him they're doing good, the kid feels good. And they've got this positive self-esteem. Now, kids don't need to wash their hair every day. They still need to bathe because, they don't wipe properly, right? We want to make sure they don't get any rashes down there, and we don't want them to smell, of course. We know that clothing should be, clean, washable, not too tight, especially shoes. I mean, this kid grows out his shoes, I think, every 2 months. We have to go up a size in them. So just making sure that he's fitting in things properly. Now, you were talking this week in discussion question all about accidents, accident prevention, right? Now, we know toddlers are like an accident waiting to happen because they're that explorer. But preschoolers are understanding more, but you got to explain to them why and how and what. So knowing, get in the car seat, knowing to get their seat belts on, or now, mom, you forgot to buckle me up if they can't do it all their way, right? Very important. Burns, putting their hands up to the stove, not knowing the water. Is your water in your house too hot? Turn the water heater down because they will turn it on inadvertently, whether in the bathtub or, in the sink. They're also, they at this age are starting to opening cabinets, get their own stuff to eat, refrigerators. They need to know what's good and what's bad. They need to know about that stranger danger, as I call it. I mean, Christian's the most friendly kid you ever meet. And we're like, you just can't walk into people's houses. I mean, Halloween, he would go and just walk into people's houses. And we're like, Christian, get over here, and he has to understand that it is something that we don't want you taken away from us, okay? And we know that they need supervision. They can't just be sent out on a bicycle to ride around the block at this age. They still need someone there to keep watching them. Imaginary playmates. Every year, a kid who's like 5, 6 years old sitting there talking to themselves, playing with their cars and, this and that. It's just part of, I mean, Christian's an only child in the house. So he always is doing this, and it's just part of his imagination. It's that magical feelings that he has. It's this imagination. So we know that parents are the people who put the behaviors in a child. We know that children are stressed. You've got to be careful the type of timeouts and stuff you do. They could be stressed because their horse died, their dog died, their nana moved away, the this, the that. I mean, still bad behavior is not accepted, but it shouldn't be made, like a normal timeout. Like, why don't we just sit together for a second and let's think about what you just did, not like alone. And let's talk. That would be the time that you would do that for that stressed moment because kids need that. Hospitalizations, these kids are aware. They're aware if mommy leaves, if they're not there. They're aware that there's needles and all sorts of bad stuff at a hospital. So you've got to be careful with, especially the parent cannot stay with a kid. Now, not every parent has one kid or somebody with the ability to stay with their child 24 hours a day. Some of them can, most can't. So they have to go to work or they have to go home, check on their other kids or whatever it is. Remember, there are stages of separation anxiety. And there's protest, despair, detachment, and regression. And what is that? Well, a kid whose mom is to say, I'm sorry, I have to go. I'll talk to you later. Have the nurse, I'll call the nurse and, I'll talk to you or whatever. Um, and mom walks out and what happens? 4-year-old starts crying, Mommy, no, come here, Mommy. I need a hug, Mommy, right? Mommy, and I'm like, no, Mom, just go. It's okay. And I would sit with the kids Then after, it could be a day of it, you don't know, and depending on how long the parent has to leave, then they start, detaching from it all. They start regressing, sucking their thumb. They might even wet their pants, right? Even if they're potty trained. Again, stress, 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 and regressing. And then parents come back in and they don't pay them attention at all. And that's normal part of separation anxiety. So assessment, things that you need to look at. Well, if you have a kid who's 6 years old who don't want to play with another kid or can't share, that's not what a 6-year-old should do, right? These kids really should want to play with a group of kids, right? Is the kid in the group or that solitary play, right? They should be wanting to play with other children. And if not, why don't you want to play with those kids? There are some kids who like to sit in the corner, don't want to be involved. Why is that? There might have been something that happened to them. These kids sit there and they talk to those imaginary playmates. Now, at this age, they're okay. Through 7 or 8-year-old with an imaginary playmate, then that's a problem. But at this age, this is absolutely normal. And they sit there and talk and they answer each other. And, it's a sign of, insanity, right? You ask a question and you answer yourself. Well, that's what these preschoolers do. And attention span, they don't have a big one. You've got to have them involved in something that they can do in quick spurts. They're not going to sit there for an hour, doing a painting or something. 15 minutes, maybe half hour if you're lucky. And then they're going to be up and moving and creating havoc. Now, the Denver Developmental Screening Tool, it's not an IQ. It addresses the personal, social, motor, language skills and seeing if they need some sort of therapy. Now, there's a YouTube channel if you want to see a little bit more about it, and we put it here for you. Now, school age children. Now, school age kids are ages 6 to 12. This is going from the kid to a young adult, if you think about it. 6-year-old, they've got all their baby teeth in, right? They start to lose them now. And by 12, they're going through puberty and all their permanent teeth are in. So, wow, huh? Really a lot of stuff that goes on. They are more about, they want to see things. These kids are into Frozen and they're into magical evil powers and, they want to be, the Pirates of Caribbean or a Jedi or whatnot. Or the little girls want to be Belle, right? Snow White, the princesses. At this age, you're starting to get a friend, somebody outside the family, and they're starting to sometimes get together with that person, especially if they live close to each other, right? And then, they have their friends, starting to get those close relationships. And it's same sex peers in school age. We know that school age children, they're judged on how and what they do. If they do something well, they're going to be told they do well. And if they're not, they're going to be told, you could do that better or do it again, right? Now, Erickson talks about the sense of industry. Industry, just think of it as a factory, a building, something you build and you did it well and you're proud of it. That could be, I spell well, I do math well, I run fast, I hit the ball fast. Something you do real, real well. Well, what's the other stuff you can't do? That's the inferiority. So Erickson, industry, my building, my factory I made that I'm really proud of, versus all the other stuff I can't. You can't do everything well, period. There's always things that you need help with. And we know that they look at their peers to try to get praise from them on that stuff of industry, the stuff they do well. They want to say, wow, how did you know how to spell that word? Or wow, how did you run that fast, right? We know that they've gone from the point of just reading things. Now they're understanding what they're reading instead of just the words. Because at first it's just, I got to get through these words. I don't know what these words are. They're just learning what they are. They like to work to a reward. For instance, Christian has this computer program, that they come home and he has to do every night for 30 minutes. And if he does it every night, after, 2 weeks, the teacher has a little prize giving for those students who did it. That's the delayed reward. They know they'll get something if they do something. And that's what that means. We know that kids want to do something and they want to get it done the first time, or they're going to be screaming, yelling, and having a fit, right? I'll give you a very simple thing. Christian used to throw darts. I've got a dartboard in my back porch, and we have it so he can throw it and couldn't get it in. Today, just today, he went out there, started throwing the darts, and he started like, I can't do it. And my husband, we call him Pop Pop. He went out there and just showed him how to relax and do it because he was getting a fear that he couldn't do it. So why should I keep trying? And that was because he was unsuccessful. But you need to show him that if you try again in a different way, it's going to work. And that's how parents and those adults in the life should be. So Erikson, Freud, and Piaget. I've said a little bit about them, but let's go a little more. Erikson, what's that industry? What do I do well? Right? That's the factory. That's the building I'm so proud of. I'm really good at writing. I'm really good at spelling, math, whatever it is. Freud is more about sexual latency, and this talks about boys like their mothers and girls like their fathers. And it has a little bit to do again with same-sex peers and being part of it. And now Piaget starts to know that they can take objects and separate them in classes, whether it's by color, by shape, by size, similarities, or these are all Paw Patrol, these are all Cinderella. They know how to separate them. That's what that means there. Concrete operations. They're starting to be able to figure things out logically and putting them in order in their way. Their physical growth, we know that school age, they do grow a lot, but remember, it is a slow, steady, where they get higher, they gain weight, they gain height and weight, et cetera, et cetera. They gain more weight than they do height at this point. Usually, school age kids, kindergartens are more thinner, and they tend to, gain the weight as they go up. We know that they are right before puberty, they actually slow down their height. And you can sort of see it coming. Start to get a little pudgy, and then you start seeing girls starting to get breast buds, and something's going on. We know they're more coordinated. Little league starts when, they're 9 years old. So, they're getting more and more coordinated. And again, they're shorter. So they have a lower sense of gravity. Their primary teeth starts to drop out, which is, all their baby teeth start to drop out about 6 years old. Christian still hasn't lost a tooth. But again, that's not abnormal. All the kids are different, but in this area, school age, he will. We know that once they come out, you're going to see 4 permanent teeth a rep per year. And by 12, when they're getting out of school age, all of their permanent teeth are in. When we talked about infants and we talked about their GI tract and their immaturity, we know that food will be in their stool even after 6 months because they don't digest it all. Well, now at school age, they can digest it. They can use it. You're not going to see the food in the stool. We know their stomachs are getting bigger. They can eat more, but they don't need more calories unless they are those kids that are like always on the go, right? Their heart, which was really big in the chest as an infant, now is smaller in proportion to their body. One of the other things that we need to look at is children when there are, for instance, I have a 9-year-old grandson who weighs 145 pounds and he looks like he's 11 or 12. The kid just turned 9 years old. So size has nothing to do with emotional maturity. He still is a child and must be explained things like he is a child, okay? Remember, kids that are taller, heavier, are going to have those peer problems and that talk, right? Kids can be mean sometimes. So identifying their gender, it's like, what do men do? What do women do? Again, it starts with the family. Does daddy make the dinner? Does mommy make the dinner? Right? Not every family mom makes dinner. My daughter has a husband who he makes dinner because he cooks better than she does. So, what is the role? What do they do? Again, different for each children, and it's from the family. We know that in school behaviors, we know that boys, because their boys will be boys, right? Aggressive behavior is more accepted than girls. Now, what about me? I was born with 6 brothers in the house. Thank goodness I was a quiet kid, right? Because I could have been that aggressive person, but it is boys more than girls. And we know that girls tend to act like more girls and boys tend to act like boys. And it's just the roles that they do assume. In school, you've got smart kids and you've got kids who really need help. And either way is fine. But again, don't try to make a kid get all A's, which is not achievable. As I tell you as students, you don't need all A's to be a PN. You do not. You just need to pass the course. I've had this saying that I was taught by some nurses where I worked in the emergency room. They said C equals nurse. And it's true. So that realistic goal of all A's, as long as they're understanding the information and can use it and build upon it, we're doing good. Not all kids can write it, can always, perform there on that piece of paper. We know kids that they need to be in school and attendance, and they look at that. Kids who are in problems that are always late, that are attendance problems, those kids, the schools today will send people out to check on them. Sometimes, parents can't get them there, whatever, but that leads to problems with the children because that daily, Monday through Friday, is something they need to be with other kids and, for them to talk with other kids, et cetera, et cetera. And homework at this age, it's not for me to tell them to go do it. It's like, okay, get your homework done, and when you're done, we'll do something. It shouldn't be mom and dad doing the homework for them. They should do what their homework is. Now, there's all sorts of names of stuff. I can't keep up with them all, but remember, there's a lot of slang out there. The one thing I have learned is if I don't understand a word a kid's saying, I'm like, well, what does that mean? I mean, dope, goat, Gucci, lit, oh my gosh, salty, sick. I mean, what are all
Like
these?
3 adolescents.
Yeah, I
It's
know.
like, what is
I
that?
I do not understand all of them, and you don't have to. But when you ask, they appreciate it, believe it or not, as a nurse. 6-year-old, get up and go, go, go. They like to start stuff and go to the next and start it, go to the next and start it, and they have to clean up behind themselves after each one, and they don't like it. It's just what they do. They're like running around in circles, doing whatever. They sit there and talk, 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 and some of it you don't even understand. Their minds are going off into this magical thinking of I don't know what. I'm like, do you ever be quiet? And it's true. I've watched him. This is Christian. I mean, he's right at that age, and he has a vocabulary I don't even know. He's got words I don't understand how he's learned so much, but he is a sponge, and he does learn. They still require a lot of sleep, 11 to 13 hours at night. So, I mean, making sure they get their sleep keeps them alert and not cranky. You don't want a cranky kid. You know, again, school age children will play boys and girls, but same sex peers is what they want. And that's according to Freud, and that's according to Piaget. Same sex peers. They tend to relate. They're both boys. They have the same issues and troubles, right? Getting to go to school and doing the homework and going and changing classes and all this stuff, they need time. They need support to understand it and to adjust to it. Again, they never did this before at home. They went one place and did whatever. Signs of fatigue and stress. What would a kid who's 6 years old do? Well, sit in the corner and suck their finger. Maybe urinate in the bed at night, right? Or all of a sudden get really um, quiet or verbal, talking and being, saying things they don't normally do. That's signs of fatigue, not enough sleep, or something happened. Maybe something happened at school you don't know about. And they don't tell you everything. you know, this is an age where they've had a lot of diseases, and viral infections, etc., ear infections like crazy, right? Through toddlers and preschooler. And by the time they get to school age, their immune systems are really good, but they are out there. They're around a lot of people now. And as nurses, stressing that their immunizations be up to date is really, really important. Now, 7-year-olds are getting older. They're getting really want to do the best at everything. And of course, if they're not, they're frustrated, right? Um, they've got a great sense of humor. I mean, Christian makes me laugh every day with some of the things he says. He says, well, I knew all about that, Nana. What do you think? And I'm like, okay. And of course, modest. They he'll grab my phone and go into the bathroom and lock the door. It's private time, Nana. I'm like, okay, make sure you wash your hands, right? And then, of course, they love to be active. He was just out riding the bike and riding his scooter and, out there in the backyard. I've got a big cement backyard, coloring and chalk everywhere. And he just loves doing that stuff. And it's, again, keeps him moving, keeps the mind going. 7-year-olds know the seasons. They know fall, winter, spring. Even though somebody in South Florida doesn't understand winter, he's seen pictures of it. So he gets that. He understood math at age 3. I mean, this is where his mind is, but most 7-year-olds are starting to be able to do that. That's where his mind was. I mean, I think he's on 3rd or 4th grade level. He can multiply at this stage. Hands, of course, steady. He loves to play, and he does like to be independent, although he likes you to watch him. He wants to show you what he's doing. 8-year-olds want to do everything, play by themselves, extremely creative. They like to be in groups. And these kids know that if auntie and uncle come over, they're going to do good things because they're going to give them little prizes and presents and rewards, right? Because that's what your relatives do, so they behave better for company. And okay, you're talking about hero worship, whether it's Spider-Man, Pokemon, whether it's Batman, they have somebody that they do admire. At this time, 8 years old, their arms and legs are starting to grow. Their trunks are pretty long right now. Now their arms and legs are starting to catch up on it. Now we know, of course, the muscles are better and they do like competition. They like to win, whether it is in sports or anything, a game, they want to win. And they're going to argue about everything, an excuse for everything, right? Love to argue. And one of the things is now they're becoming young adults. At 8, they need to know how to talk and to show and express when they're angry in a way that's not offensive and aggressive. Your 9-year-old is more dependable, likes to do things with the family. They need responsibility. They assume it, not meaning they like it, but they do assume it. Go, here's your pile of clothes, go put it away, right? Go set the table. At this point, they should be able to do it, and they should be able to do it from the start to the finish. You could tell them, you did this, but if you did this, it would have been even better. So now they are getting that criticism. And there are little worriers about they didn't do something right or they're not going to get whatever for their birthday or etc. Hand to eye, of course, well developed. They're starting to be able to build things with their hands. Sleep is down about 10 hours, but they still need it. Permanent teeth, of course, still coming in. At this point, they should be in some sort of competitive sport. And they need to understand safety devices. Now, we just got Christian a hoverboard, and we just got him those sneakers with the skates in them. So we taught him about those wrist braces, and I explained about that parachute reflex, right? You fall to the floor, hands come out. And I know with both of those, you're going to get bilateral fractured wrists if you're not careful. So we talked about the elbow pads, the knee pads, the wrist pads, and wearing them and why. Because kids don't want to put that on. They don't want to take the time. When they want to go, they want to get up and go, right? So teaching them. 10-year-old, now you're starting that prepubertal sort of changes mentality. Girls are more older than boys by about 2 years at this point. So girls mentally, physically will be 2 years ahead of boys. We know that 10-year-olds want to be independent. They want to do things that they want to do. And they also, groups get together. They want to, as a group, decide what to do. And always through this whole thing, through all of these type of school age, this sexual curiosity and, touching themselves and giving pleasure and all of these things are normal. And as parents, the only thing I'd say about sexual curiosity, they ask questions, you answer them. Don't think they need a long detail of how babies are made. They don't need that. Find out what they know, and I would never lie. Just make it as simplistic as possible. We know girls are more poised than boys. Like I said, mentally, physically, girls are older than boys at this. We know that slang is coming out. And I know as parents and even as grandparents, you're going to say, I don't like that word. Don't use it in my house. I mean, even now I'm doing it. We know that they can say that, I can run faster than all the boys, or I'm math than all the kids. These are things they want to do. Getting dressed, the colors have to match. And it has to be cool clothes, right? They have to have the sneakers that are the in Nikes or whatever. They're starting to notice all this stuff. And they're starting to understand more about math and abstract numbers. 11 and 12-year-olds. Now, this is right before we get into adolescence. Very, very intense kids. Remember, hormones are starting to play now. This is that pre-pubertal, all of these changes are going on. They are going to argue them way out of everything. And they're going to be into everybody's business, meddlesome, okay? We know that they need a little freedom. They need to get a little responsibilities. And that lets them feel like they're big kids now. Because at 11, 12, they're adolescents almost. They need those responsibilities. You know, maybe 11, 12, I'm going to run to the store. I'll be back in 30 minutes. And you leave them in the house. Don't let anybody in the house. Don't open the door for no one. Little responsibilities. And of course, I have a ring on the door. I'll be checking it all the time. But these are things you got to do it. 11 and 12-year-olds are saying they're less concerned about their appearance. I don't really know about that one, to tell you the truth. You know, they tend to be scattered brain again, because they're in that area of not child, not adult, um, and they're trying to figure out who they are. Because as we get to adolescence, it's all about that body. Again, they're looking at their bodies. And did you get your period yet? I mean, I used to say, did you start your menstruation? Because that's the only thing my mother called it at that time. And I had no clue what a menstruation meant, but it was something that it's bodies growing up. Are you getting boobies? You're in PE, changing, putting on your PE outfits. Oh, she's wearing a bra. I'm not having one yet. These are things you're starting to notice. And I already did that. So children going that are this age, we're starting to making sure at the end of their school age that we know that they need to get checkups before they go to school. We know the HPV vaccines coming up at age 12, right? The 3 series must be done, boys and girls. You don't want boys giving it to girls either, right? Um, Even though it prevents cervical cancer, but it's still, we're protecting everybody. Hearing and sight should be checked. You know, at that age, they could be a lot ahead in school if they could hear and see better. And this is one of the times that we do. And again, 11, 12-year-olds still need to get up, get out, be active. And it's all very important for their body and their muscles and for their minds. Children at school age do need to know why they're sick. You got a cold because your mom just said that your cousin was over and they had a cold too. And we know germs are spread. And you were playing with the same toys, right? Okay, so they touched them, you touched them, and you put something in your mouth. Then there you go. That's how you spread it, you know, in a way that they understand. Young kids in the school age, for instance, you need to get an x-ray. They don't understand. They think it's x-ray beams coming and it's going to go through their bodies and burn holes. That's what a young 6-year-old would say. But if I said, we're going to send you to a place, it's called an x-ray, but it's a camera. And they're going to take a picture. It's big, it makes sounds, but you're not going to touch it. It's not going to touch you. And you're going to hear, bzz, and that's going to be the picture. And I'm going to show it to you when you come back to the room. They're excited now. I can see your insides, and they think that's great. Now, a 12-year-old, we're going to take an x-ray. It's a picture of your bones, your inside, and we'll show you if your arm is broken. These are things, again, developmentally appropriate way that we speak to these children. You know, all the time, any age kid, they need to know where they can go do their homework. You know, as a kid, I always had a table in the back room where we piled our book and we'd sit there and we'd do our homework. When we were done, we cleaned it up, made it neat, and that would be it, right? But you need a place for that so they understand. Kids need responsibility for their supplies. They lose their crayons. Oh, too bad. You know, we might get them more one time, but especially younger kids, You lost your scissors, you don't have erasers, where's your pencils? Where's your paper? Where's your books? You didn't bring your assignment book home. Christian was horrible at it last year. Horrible, forgetting his stuff everywhere. So, something they need to learn, and they need a consequence because they're not doing what they're supposed to do. And then how to make money for something. Kids, when they do good things, every now I don't have allowances and whatnot, but every now and then, if he's good, I'll say, here's $1 because you helped me bring in the groceries. You helped Pop. Thank you so much. Yes, Amanda.
So my parents did that with me too. When I was competing, that I needed a better horse, my grandfather would tell me, okay, so this is what we're gonna do. You're gonna sell your horse, and whatever you get for it, I'll match it.
Wow.
Or he would tell me, pick another horse off Craigslist or like off of an ad and or out of the paddock, and he'd tell me, I want you to train that horse, put some training into it, and then you put a price tag on it and you sell it.
Oh,
And I'll give you, and he would tell me, I'll give you 10% of whatever you sell it for.
and then you could buy your supplies, your new pants, your new this, your boots, whatever.
No, my supplies would come from whatever I would win when I would go to competition from jackpot. I would give
Wow.
the checks to my parents and they would tell me, okay, so you need boots for the horse, you need shoe. So you're gonna be responsible for administering that money for your expenses and to pay your competition fees.
They really, really taught you well because that's the way that it should be done. Not everybody has the horses like that. As simple as Christian, he just got some Christmas money and he has a wallet that I bought him and he has it put in a place and it's hidden at my house. I mean, he has his own house, but at my house. And every now and then he does something and he doesn't ask because I won't give it to him if he asks. But I'll say, here's $1. Go put it in your wallet. He's up to 50 some odd dollars already, and it's just slowly. Kid's just turned 7. He doesn't know what to do with it yet, but it's there, and he's learning the responsibilities of money and holding on to it. Really important. So the adolescent, I think it's the hardest group of kids. I really do. I think these kids get to be adolescents and then they're know-it-alls and they want to just do it and they don't want to listen to mom because I'm going to do what I want because I'm grown up now. Especially if they're that 17 age, where I'm almost out of the house, mom. Can't tell me what to do. We know the beginning of adolescence is that adolescent growth spurt where they have maturity, they go through puberty, and they're squirt up in their growth. I mean, my son went from 5'4" to 5'10" in the summer. I swear it was that quick as that pre-adolescent growth spurt. And we know all of a sudden girls get breast buds and boobies and boys get hair and their testicles get enlarged and there's all different things that they're starting. Now, the emotional maturity doesn't necessarily match the physical. So again, as nurses, we need to make sure that we understand that. Now, adolescents, they're all about Erickson. He says it's about identity. Think about an adolescent. You have to figure out, who am I? Sexually, do I like girls, boys, or both, or nobody? I have to figure out, what do I want to be when I grow up? What group of kids do I want to hang out with? Am I the punk rocker? Am I a band nerd? Or am I the sports geek? I mean, there's all they need to belong in a group. This identity. Okay, let's go further. Body image. I've got too many pimples, too many freckles. My hair's too curly. I'm too fat. I'm too skinny. My feet are too big. They're never satisfied. Body image, big thing. Also, family's not as important. Now, they still need family. They still need mom and dad telling you right and wrong. Absolutely. But they're separating. They're doing more with their, as I say, the buddies in them, because their buddies become more important than your family. They're going to be start experimenting sexuality, Freud, intimacy, right? That's what happens at that point. And again, figuring out, who am I going to be when I grow up? Do you want to be a nurse? Then, okay, your grades have to match that. And some of them, well, I know I'm going to need a scholarship, so I need to get good grades. You know, all of these things are all in these adolescents' minds now. Again, as I said, their physical and psychological changes, the puberty and the hormones and the way they look are all new to them. They were kids and babies before. Now they're becoming grown-ups. They love their privacy. They're able to address and cope with their stress a lot better. Um, One of the things that needs to be continued is a good open communication between parents, and that's the hardest thing. Kids tend to shut up because they don't want to tell mommy and daddy all the things they're doing, right? And it's understood, but parents still need that communication there. And they do need guidance, and they need to understand to take care of themselves, their health practices, and then lifestyle choices. As in, are they having unprotected sex? Are they drinking, or are they smoking marijuana, or what are they, cigarettes, or what are they doing? They really need some good, positive health and lifestyle choices at this point. We know they want to be independent. Now, it's hard for those kids to get along with parents. I say they need to sit down and come with a compromise and make a contract. All right, you think you should come home at 1 o'clock in the morning on a Friday? I've been good. I'm doing good at school. I've done my chores. Well, no, be home at midnight, or next week you're not going out. There has to be some sort of that you can work together with, okay? We know their bodies are changing like crazy at this point, and then they're getting all of these sexual urges. How do you deal with all of that, right? How do you make the right choices with that? And then now we're talking about Holberg. We're talking about doing what society says you should do. Like, we know in society you can't be out running around naked outside. You can't. Or you go somewhere, it's please and thank you, or opening doors, or if there's no smoking and there's 17 they're smoking, you can't walk into places. There's rules. You got to follow it. You go to a store, you get something, you need to pay for it. These are all the rules of society, and they need to understand that. So, as I said, Erickson is intimacy. Who am I? My body. Who am I going to be? Piaget. Adolescents can get themselves out of a paper bag by explanation so they don't get in trouble. Or, I think this is the way to explain it. They want to go out on Saturday night, and you already told them last week, no, you're not going out because you did whatever. So during the week, what does this kid do? They get an A on their geography test. They take the garbage out. They set the table. They keep their room clean. They did their laundry. They did all this good stuff. Why did they do that? Abstract thinking, if I do all this good stuff, mommy's going to let me go out because I've been good. They know how to get out of a paper bag and get what they want. And that's the way I describe abstract reasoning, right? They can figure anything out. It's beyond logical. They're pretty smart kids. As I said, we have that growth spurt somewhere between 10 to 13. And we know that boys are slower than girls. Now, these are all those sort of changes. I'm not going to go in all of them. You can look at them. We know what all happens. The whole body becomes more mature. You're an adult at this point. Puberty, you have some kids that go through it, girls that go at it 9, 10, and some girls 12, 13. It's all normal. I mean, if they're not having, their menses by 15, of course, that's something that has to be explored. But, usually those are the ages. And usually growth spurts occurs by their 18. Now, I sent my son to the Army at 19 years old. He was 5'10". He came back 2 years later, 6'5". So it doesn't mean it's all done at 18, because this kid is huge. And he was a skinny, tiniest little kid in his class all through high school. So 18 is the book, but as again, it could be different. We know that they're getting long-legged, long-armed, their bodies are shaping, they look to be a little bit awkward, we've got pimples, acne. This is all normal with these kids. We know with those hormonal changes, now hair is growing, armpit hair, pubic hair, facial hair on, your boys. And then all of the bodies changing. We're getting enlarged everything. And then the voice on boys, I used to call my friend's daughter, my friend's son, excuse me, for his birthday. It's one day I always would remember. She's in New York, and to tell happy birthday. And one year, all of a sudden, his voice was from this little voice down to this really deep voice. I'm like, oh my goodness, you've grown up on me, Mikey. All of a sudden, the voices gets deeper and they become more male in that. Okay. Remember, boys do need to do a testicular self-exam. We know girls should do breast exams, but I've got stories about testicular exams and an 18-year-old boy who ended up with metastasis because he didn't check it and died 3 months later. So testicular exams are very, very important. We know pubertal changes occurs 2 years before boys, like I said. We know that all of a sudden, all the fat's moving around, these skinny little waist, and we're getting these curves and whatnot. All of these things are important. And during these changes, this growth, etc., nutrition is so important. Now, this is Tanner stages. This shows what you should see. You see, boys going from a small penis, small testicles, to now we have hair, a bigger penis, and larger testicles. And then you look at girls, far to the right, the breast, there's a bud, and then it gets bigger, bigger, and then of course you have breasts. This is part of those stages. Tanner stages of maturity. This is something that you'll see questions about. What is it? What does it discuss? And it discussed the maturity, that puberty in children. So their identity, we know all about that. We know that these children are going to make several, changes in who they want to be. I mean, that's part of it. And even in intimacy, they're going to be, experimenting all over. And that's normal, and it's what they should do. And again, remember, at this age, children need to make their own decisions and live with those consequences, good or bad. Initially, our spirituality, as I said, comes from parents, right? And the family. Well, at this point, adolescents, now they are making their own decisions on what they believe in, okay? Their body image, as I said, they think everybody's staring at them. Nobody's looking, but your pants are too tight. They're ugly, or, I have a big pimple on my nose. They think they're looking at them. They do like to take pride what they do well, whether it's in sports, whether it's in school or whatever, and they want to be liked. They want to be liked by their buddies and them, by their peers. They like that. They want to feel like they belong. That's their peer groups, whether it's the band geeks or it's the sports teams, right? School is huge. They're there all the time, right? And have all of these extracurricular activities, etc. And belonging to whatever group is so important, or what clique, or whatever you want to call it. Now, at this point, girls and boys usually have a same-sex peer, which is their best buddy, their best friend, right? This actually is going to prepare them for their future partner in life. How they treat that best friend in high school is usually how they're going to treat their partner in life. So if you have a best friend you've had since high school and still there, you still love each other, you probably got a very loving whoever your partner is, because that's what you have learned. As I said, Piaget, it's that person who can think and figure out what they want. And they do it systematically to get what they want out of it. And it's called formal operations. School age children are concrete operations. They have to see it to know it. In adolescence, they already know that, but then they figure out more to work upon that. So it's even more. They can work with what they know and figure things out and make it work. They're starting to understand other people, other points of views. They can sympathize, empathize. They know who they are and what they do, and they know that everybody is different. And this is all accepting because they understand differences. As I said, sexual behavior is whatever they are, whatever they like. They could date in groups, couples, singles, males, females, it doesn't matter. It's all part of that exploration. We know that exploration and those responses can affect growth and development with them. If they don't have that ability, it's something that should be experimented somewhat at this point, because later on you can have that partner for life, right? And we know unplanned pregnancies and sexually transmitted infections are the two major complications of adolescence. As nurses, we can talk to them about their sexuality and help guide them get what they need, whether it's condoms, whether it's birth control, or talking about it, or maybe this girl's having frequent urinary tract infections, and you're like, well, and they don't like to talk in front of their parents. I mean, I wouldn't talk in front of my mother. My mother would shoot me and lock me up for years, and that would be the end of my life. But if she wasn't in the room, I might talk to a nurse. And that nurse does not have to tell that parent what that child said, unless it was something that could hurt them or others. So sometimes it's the nurse that helps these adolescents. So sexual education, we know we should say abstinence, sure, they're going to do what they want, but give them oral and written information, that's age appropriate, so they can make their own decisions, and to talk about those things. And as I said, most of that is done without a parent in the room. So what has been shown is early sex education from parents, it doesn't make the child want to go out and have sex more. They just have information. And sometimes it's because they know that they should protect themselves against disease or pregnancy, which stops them from having that sex. They'll do it in a more rational, better way for them, right? We know that all of them are different. We know that there are your peers having sex doesn't mean that you have to have sex. It doesn't mean homosexuality is wrong or right. It's just part of life, and it's that experimentation. And it's something that as nurses, we need to be aware of. So we know parents, I've already said this, talking to them, it's hard, letting them talk about their feelings, but trying to keep communications open. I know I wouldn't speak to my parents, but if something really bad happened and I was upset, I'd come home crying and my mom would sit down on the bed and hug me and say, okay, what's wrong? I mean, I might not tell her the whole story, but at least, as an adolescent, you could at least talk and know that no matter what, mommy was still there and will support you. Health promotion, we know that adolescents tend to, especially boys in the very beginning, don't want to take a bath, a shower, brush their teeth. They don't want to go and do all of those things, and they just want to sit in front of the computer and eat and get overweight or whatever. These are things that needs to be addressed. You know, we see a child doing things that are, you don't know if they're good. I mean, you know, adolescents don't like you in their computers checking it out. But I mean, this idea of pornography and everything that's on the web today, it does need to be looked at because we know. And how many documentaries do you need to see on young girls that go out to meet this young guy, turns out to be middle age, and they get sexually abused, et cetera, et cetera. So making sure that we're aware of that. You know, as I said, nutrition, nutrition, nutrition. Remember, they've grown a lot in the beginning of adolescence. You know, also, you know, they're building their nutrition for the rest of their life. They really need to eat properly. I mean, what do girls do as adolescents? They're too fat, right? They get a bottle of water and a power bar, go to school, and that's all they have all day, and then come home and maybe have dinner because they're afraid of gaining weight. They want to be skinnier or whatever. So skipped meals are common. Or they're eating out and they're eating all junk all the time. Both are a bad thing. But remember, if they're not eating properly, you will have some lack of vitamins. So again, making sure they get their calcium, iron, B12. If they're tired all the time, you got to look at that iron B12. It could be something like that. Also, no, different cultures don't eat meat. So you're not getting all the protein and whatnot you need, right? So make sure that they're getting enough of their vegetarian foods that can make up for that. Remember, if they're in sports, that they're going to need extra type of foods, that they take snacks, you know, before they eat. They say caffeine and alcohol shouldn't be drinking uh, when you're in sports because it gets rid of all your water, and you need that water for hydration. And we know some high school kids want to get in college, and they might be tempted by doing anabolic steroids. And it does happen. Just to be really careful because it affects bone growth and it can affect your heart valves later on in life. Again, hygiene, make sure they're doing it. I mean, my son came home with a tattoo and I wanted to beat him up. He was 16 years old. He came home with his tongue pierced. I'm like, what are you, nuts? Who did that? Nobody gave you permission. It's just something that they do. Again, if they do, then they have to take care of it. Dental health, important. They need to brush their teeth and they need to floss. Remember, these are all permanent teeth. Sunbathing. I live in South Florida. You know, today they worry about skin cancer and to use UV protection. Adolescents are now getting their driver's license. And we know accidents in any age children, the highest is motor vehicles. Absolutely. Remember, they are learning how to drive, or they're putting kids on the hoods of the car, driving around parking lots, trying to, you know, woof them off. You know, how long can they stay on for? Playing games. You know, all of this stuff is something that can really hurt children, especially your adolescents. Um, Water safety. You know, little Christian at age 2 could do a front flip in my swimming pool without floaties or swimmies. Now, he would put a little head up and he would get to where he needs to go, but that kid would never get into that water without telling one of us because he knew the drowning. And I've seen drownings. And, you know, drownings, once they're drowned, they're, you know, anoxic and it could cause brain damage. And we don't want that. Contact sports, making sure they have the proper equipment is the most important thing again. Now, the female athlete triad. So you have problems with eating because you don't want to get fat, right? And then you're in sports and now you don't have your period and you're not eating right. So you're not getting all your calcium. So now you have bones that are not good. All part of it. There's two sort of eating disorders. One is anorexia nervosa. This is the one where you don't eat anything and you exercise like a crazy person because you're trying not to gain weight and you want to lose weight and your eyes see you as fat. And even though you're 70 pounds and 5'2", you think you're still fat. That's anorexia nervosa. Bulimia nervosa, you binge eat and then you vomit. You will see usually decayed teeth in that child, that teenager who's bulimic. Anorexia, their teeth are okay. They're not eating, so there's nothing to vomit, okay? So bulimia, you're going to see those teeth. And one of the clues is going to be the absence of menstruation, okay? Addiction is something that, you know, teenagers, they love to experiment, or they've seen their mom, or they've seen adults experiment. So I am too. I mean, one of the things, the biggest one is alcohol. They'll go into your alcohol cabinet, take it out, pour it into a water bottle, like one of those clear things, and then they'll put water back in your alcohol bottle. And oh, I don't know what happened. It wasn't me, right? And even though you mark the bottles or whatever to be sure, they're still getting to it. So again, these are things addiction trying to prevent them. So if we see a kid with all of those mood swings and all of that sort of stuff, we know that there is a possibility. So it's something that we call PACE is what we're going to assess them for. It's the parents, the peers, and are they smoking pot? A, alcohol, or what's going on with the automobiles. C, cigarettes, and then give them that education. Now, if we're seeing that there's issues with any of these two, these are ones that really need to have some sort of referral. Stop it now before it gets, more. We know that drug abuse, again, it's that different mood. It's going to be depression, or you'll see them overly excited, changes in behaviors. And we know one of the things that adolescents are highly apt to do is to commit suicide for either this depression, whether from drug use or poor body image, not being accepted by peers. That's why suicide is so high, because they don't like themselves at all. And or they're on drugs, they're depressed and they can't, comprehend well. So school nurses is a great thing to be. I suggest it for those people, young students who want to have families. You have every day the kid has off, Christmas, holidays, summer break if you want with them. But school nurses do hold a lot of responsibility. And it's that kid who all of a sudden is complaining a lot, sent to the office. Something's going on, the younger kids, that's stress. Or we're starting to see kids just not looking themselves, that depression. Always encourage that open communication, and school nurses making sure they have hotlines and stuff posted everywhere and have those referrals available and ready to send out. Again, adolescent pregnancy, it's hard with it. And again, school nurses are going to be involved with this and making sure that, these risk factors with it, how old are they? And then are they eating right? Are they still active? And then did they get proper care for their pregnancy? So at first, the adolescent's going to say, yep, I'm pregnant. And it's not real yet to this adolescent. They don't like, I don't know. Well, by second, now they're starting to feel that fluttering in there. And then if they continue on, they're going to be ready and get ready for that child. So nurses, keep your communication open. I start with things like, especially when I was working in the emergency room, because you get them quick in and out, and they're in there with a problem. So I'd be like, "Oh, you listen to music? Who do you like?" Or, "Oh, I love your Nike sneakers. Where'd you find them?" Or, "Oh, I see you have a sports jersey. You like sports?" Or, "Have you thought about college yet? What do you want to be?" All of these questions. Try to open communication, because I'm an adult too. They don't like me either. I'm threatening. So you've got to open it up. And then let them feel comfortable and listen to them. And let them know that you don't have to tell these things to their mother or father. And they can tell you things and to try to help them. We know that parents need to understand that adolescents at this age, part of the rebellion, the yelling, the screaming, the I don't want to, you can't tell me what to do stuff, is they're trying to get their independence. But they should, if possible, get them to sit, listen, and again, make that compromise. With adolescents, nutrition always is going to be number one on any age group of person. Dental care, you don't want rotten teeth because then you're not going to eat, right? And then, of course, body image is ruined when your teeth are rotten. Making sure personal care, body piercings, that they take care of it. I mean, my son ended up taking his ring out of his tongue because he didn't have money for the wash to wash his tongue out to make sure he didn't get infected, and it got infected. Accident prevention, we know motor vehicles is number one. Substance abuse, being able to take care of themselves, and those risk behaviors. What do they do that they shouldn't be doing? So these are all some things about teenagers or cute little sayings that I put there in the end for you. Any questions?
Yes, all this is for the exam, right?
Yes, it is.
Okay.
I will be sending you out the study guide and you can pick and choose out of there. I'm giving you the over like really guidelines of it.
And
Okay.
how many questions will be, Professor? Like
50,
50?
50, 5 math questions.
Oh, you respond my next question.
5. And I know you're going to ask. That's why I'm doing math next week for you. All right, we got it's like 29 question cahoots. Let's get it done quick. It's some really easy questions, I think, and I think it helps. And then anybody who wants to stay, we can go over the quiz. All right, I'm going to get started because we're a little late tonight and I don't want to hold you over too much. Week 2, preschooler, school age, adolescent. A preschool child is asked, why do trees have leaves? Which response would be an example of animism? So animism is acting like an animal, right? Like the toilet bowl flushing, it's the mouth eating their body parts, right? Is to hide behind when they are scared. Okay? That's why they have leaves. It's there for them to use, not literal. Cephalocaudal describes development that is. Now, I'll always throw in last week's questions, and I think it's important. There's some concepts. You're going to see these words, so I throw them in there. And if we look at the word tear it apart, cephalic, it's head to toe. If anything else works, start with that head to toe, cephalic. What task would be appropriate to expect of a 5-year-old child? Remember, at this age, they want to do things. They want to help you. They're 5 years old. What's appropriate? And that's setting the table with paper plates. I wouldn't put any glasses on these kids yet or knives. A father's concerned about how long his preschool age child will continue sucking his thumb. What is the best response? Remember, preschool is at ages 3 to 6. And at 6, it's school age. And what do we know about sucking the thumb or the finger? Usually, they will stop by school age, and it's because baby teeth come out, permanents come in, and you don't want them crooked. So they usually will. The way a child grows and develops is known as, you'll always see definition questions on your exams. And if you looked at that worksheet I sent you for exam 1, you're going to see a lot of definitions. And it's called maturation. What should the nurse suggest is the most appropriate toy for a 3-year-old child? So 3-year-old is still a toddler. 1 to 3, and going up into the preschooler, right? The only thing is a large construction test set where they can make and build things. Push pull tops, that's a little too, the tops you pull, they're not going to be able to do that. And also remember, nothing with small parts. They put them, everything is in their mouth. What fear is unique to the preschool period? What fear? Preschoolers. What are they afraid of? It's all about bleeding, right? It's the Band-Aid time. Preschoolers, a little bit older, it's the death, right? At the first beginning, it's the bodily harm, and it's the Band-Aid. It fixes everything. What do abnormal results on the Denver 2 screening test indicate? So it doesn't tell you anything, but you need to get it further evaluated. And then they can institute, what do they need to do? Speech, physical, occupational therapy. What do they have to do? Okay. When planning an activity for a 3-year-old child, the nurse bases the plan on the average attention span of how many minutes? 3-year-old, how long you think you're going to have them sit? About
Oh,
15
geez.
minutes. It's about 15 minutes. Try to take a 3-year-old kid to the movies, it's hard. Because, unless it's really magical, and it's not going to happen. A 4-year-old insists he has more money with a nickel than his father, who has a dime. Because of Piaget, why is that true? Remember, it's the thinking. So when you think about, you've got a dime and you got a nickel. One is bigger than the other, right? What does that 4-year-old think? And it's what we call intuition. They think the bigger looking thing has more money in it than the smaller dime. And the quarter, well, they're lucky with that one, but that's the difference. It has to do with a glass of milk also. You take a big one that's skinny and put it in a small one that's short, and you pour it's the same amount. That kid will pick the tall glass because it must have more in it, and it doesn't. It's the same. What should the nurse keep in mind when planning to teach a 4th grade class about nutrition? So remember, Piaget talks about this, talks about concrete, right? Abstract thinking is your adolescence. Concrete, they need to see it, know it, touch it, feel it, okay? And then logically, they can figure it out. School-age children can be taught, dare to keep kids off of drugs, teaching them about nutrition and preventing obesity. These are all things. They're logic and they can see it, feel it, touch it, they understand it. What do you call a type of family that is traditional? For example, one mother and father and their biologic children. Again, it's another one of your definitions. It's called the nuclear family. You know, there's all sorts of ones. Blended is when you have two parents that were married before the kids come together. Extended means nanas with the family too. And communal could be like your church family. If a new mother states she cannot breastfeed her baby, what would you recommend? Again, something from last week, but I want to check you on it. Iron fortified formula or breast milk. Some parents just can't breastfeed and you can't make them feel bad. As long as they're getting iron fortified formula, you're doing good. An 8-year-old child has frequent nightmares and the parents are concerned. What's the nurse's best response? You know, they're absolutely normal, you know, and children's minds are going and they're thinking, and they're afraid of that cutting and hurting and body full and innards falling out and all the blood's going away. I mean, it's even more intense at this point, and those nightmares are normal, and it's something they need to talk to the parents about. A 10-year-old girl likes school, plays the flute, and plays tennis. What do these activities help develop? 10-year-old. She does them well. She likes it. What is that? It's that house, it's that building, it's that factory, it's that stuff they do well. Industry versus inferiority, what I can't do. School age Erickson, very good. What statement by an 11-year-old child leaves the nurse to determine he has moved away from the mindset of egocentrism? What is to be egocentristic? What is that? You know, when you're egocentrical, you're always thinking about yourself. That means you start thinking about others. So I'm sorry, I hurt your feelings, okay? It's not about I, me. It's now about others. That's how you remember that one. The school nurse is preserving a tooth that was knocked out. What will the nurse be especially careful to do? Now, permanent teeth that fall out can be put back in, but they must be placed somewhere, one of these, where it keeps the root and the tooth alive so that we can put it back in. It's usually the front upper teeth that come out most of the time. And you need to only take and handle it by the enamel part, not the root, and you put it in cold milk. Cold milk keeps it alive. And I've watched dentists just numb up the area, keep it good numb with the cream, and then take it and push it in there. And then they're told to eat very soft foods and it will catch back in there. So it would be, can you imagine the amount of money to put in a front tooth with a post and all that? It saves a lot of money. put it in cold milk, handle it properly, and we could get it put in. What term is used for a baby that's up to 4 weeks old? Told you this last week. As in the first 28 days of life, they are called. And then after that, they are called. It's a neonate. And then after 28 days up to 1, they're an infant. The nurse is assessing a 13-year-old boy. Which physical change indicates that male puberty has begun? What's the first stage of Tanner's with boys? And it's the enlargement of the testicles is number 1, okay? In girls, it's breast buds. So, I mean, with boys, we don't really can tell, but girls, you can see the buds coming, like, oh, she's going through puberty. A parent comments that her adolescent daughter seems to be daydreaming a lot. What does this behavior indicate? You know, when you're daydreaming, you're thinking about stuff and you're trying to figure things out in your own little world. And it's not a bad thing. I mean, we all do it. It's just part of their growing up and understanding. The nurse is planning care of an adolescent. What psychosocial task is most important for the adolescent? Adolescent. What did I tell you they're all about? Industry is school age, initiative is preschool, identity, me, body image, adolescent. Yes, very good. What does the first tooth generally appear? When does it appear? And as I said, all kids are different, but by the book, this is generally when you'll see the first one. And it's 6 months. And as I said, my kids never got teeth till 15 months, and then they got 6 or 8 of them all at once. So, but 6 months is the book where it says. What can the nurse suggest as a good dietary source of zinc for an adolescent who is a vegetarian? As you see, I will put questions in there that I just don't throw in the lecture, but it's a great place for you to hear it and see it. Nuts. Nuts are a great choice. You know, kids like nut bars, adolescents. So it's a great thing to give them. A nurse takes the height, weight, and does vital signs on an infant. What level of Maslow hierarchy of needs is that? Now, on your handout, your worksheet, we talk about Maslow. And it starts about basic needs up to esteem and everything that's needed in between. What is height, weight, and vital signs? You know, that's your basic needs. That's your physiologic needs. Very good. At 6 months, solid food is offered. What would be the best choice to offer first? Rice cereal. And the reason is it's less allergenic all along for all children. According to Freud, an infant that likes to suck on a pacifier a lot is in which developmental period? Remember, infants, the one thing they do is pacifier. Little sugar water on a pacifier can relieve the biggest pain, and it should be used with pain management. all about oral, oral, oral. And then we know toddlers, it's all about anal and potty training. What stage of toddlers, according to Erickson? Toddlers. What did I tell you toddlers are like? Remember, toddlers are me, mine, mine, mine. Autonomy, autonomous. That's me, egocentrical, I. So that's all about, I want to do it. And then shame and a doubt is somebody's telling them all the time, no, don't do that. You're going to hurt yourself. What reflex causes an infant to stick their tongue out when you place solid food on it? At 6 months old, you try to put a spoon, right? And they're sitting there and they're sticking their tongue out. What is that? They know how to suck on a bottle or a breast. It's called protrusion. It's and eventually they learn how to keep the tongue in and keep the food in. And last question. A girl tells the nurse, I love Katy Perry and I want to be a singer. What statement is typical of what stage? My daughter wanted to be Mariah Carey. And that's really early adolescence. That's that 12, 13-year-old little girl. See how we did today. Frank, good job, Frank. You did it.
Hey, all right.
Whoop, whoop. Amanda, good job, Amanda. Good job. And number one. Whoop, whoop. Yvette. Whoop, whoop. Number 4, Kimberly and Akaka. All right. So that's all I have today. Remember that you have that discussion question due. That is it. Not too bad. Remember, next week is going to be all of the reviews. So make sure if you can attend to listen. Remember the math, I'm going to be doing it also. So if you need help there, please come to it. I will send the review to you all. I do an RNPN all together, people, because math is math, no matter who you are. So any questions?
Are you gonna go over the quiz after?
Yes, I am.
Okay.
All right, let me turn off the recording because we're done.
Miss